Osteoarthritis results from cartilage damage that triggers a metabolic response at the level of chondrocytes, and the cartilage becomes dull, yellow, and granular. It's soft and less elastic and less able to resist the wear with heavy use. A number of factors have been linked, like estrogen reduction, genetic factors, and obesity. Regular moderate exercise decreases the risk. The body cannot repair cartilage because of ongoing destruction, and continued changes in collagen structure of cartilage leads to fissuring and erosion of the articular surfaces. As central cartilage becomes thinner, cartilage and bony growth increase at the joint margins. This creates incongruity in joint surfaces and creates an uneven distribution of stress across the joint and contributes to reduction in motion. Inflammation is not necessarily characteristics of osteoarthritis. Secondary synovitis may result, which is when the phagocytic cells try to rid the joint of small pieces of cartilage that have torn away from the joint surface. The inflammatory change contributes to early pain and stiffness. Pain later in the disease results from contact between the exposed bony joint surfaces after articular cartilage has completely deteriorated. Osteoarthritis is sometimes called degenerative joint disease or osteoarthrosis and is the most common form of arthritis. It most commonly affects the joints in the hands, hips, knees, neck, and lower back. In the early stages, rest relieves the pain. In the later stages, pain is with rest and sleep is disturbed because of the pain and increased joint discomfort. It becomes worse as barometric pressures decrease. Osteoarthritis symptoms often develop slowly and worsen over time. The signs and symptoms of osteoarthritis include pain that the joint may hurt during or after movement. The joint may feel tender when applying light pressure to it. Joint stiffness may be noticeable when waking up in the morning or after a period of inactivity. Loss of flexibility. May not be able to move the joint through its full range of motion. Grating sensation. May hear or feel a grating sensation when using the joint. And bone spurs. Those extra bits of bone which feel like hard lumps may form around the affected joint. Increased pain, though, can contribute significantly to disability and loss of function, and pain may be referred to groin, buttock, or medial side of thigh or knee. Sitting down becomes difficult, as does getting up from a chair when hips are lower than the knees. The joint stiffness occurs after periods of rest and static position. Early morning stiffness usually resolves within 30 minutes. Overactivity can cause mild joint effusion and temporarily increase the stiffness. Crepitus can also cause stiffness, a grating sensation caused by loose particles of cartilage in the joint cavity. It indicates a loss of cartilage integrity. It is present in 90% of patients with knee osteoarthritis, and it usually affects the joints asymmetrically. Most common involved are the joints of the fingers, the distal interphalangeal, proximal interphalangeal, and metacarpophalangeal. Weight-bearing joints like hips and knees. Metatarsophalangeal, the joint of the foot. Cervical and lower lumbar vertebra. Heberden's and Bouchard nodes are red, swollen, and tender, and are visible disfigurement and can cause patient to be distressed. Does not cause significant loss of function. Knee osteoarthritis often leads to joint malalignment and results of cartilage loss in the medial compartment, a bow-legged appearance, or altered gait. Advanced hip osteoarthritis may cause one leg to be shorter. Changes do not always correlate with degree of pain patient is experiencing. There are no laboratory abnormalities or biomarkers that have been identified. Routine blood tests are useful in screening for related conditions and establishing baselines from the therapy. An early osteoarthritis test to detect joint changes would be a bone scan, CT, or MRI. In progressed osteoarthritis, would detect a joint space narrowing, bony sclerosis, osteophyte formation, and this could be seen in x-rays. Osteoarthritis bone scan. If you look at the picture, the arrowheads point to areas of symmetrical increased isotope accumulation in the knees and shoulders, which is suggestive of osteoarthritis. For the patient, you would focus on managing the pain and inflammation, preventing disability, and maintaining and improving joint function. Foundation for osteoarthritis management is non-pharmacological intervention. May use debridement, but it is usually not recommended. It is effective in reducing pain and improving function when it is used to repair ligament tears and remove bone bits or cartilage. Rest and joint protection. It may help reduce pain and stiffness. Heat is used more often than ice, and ice is appropriate for acute inflammation. Heat therapy is especially helpful for stiffness. Hot pack, whirlpool baths, ultrasound, and a weight reduction program is critical for overweight patients. Exercise is a fundamental part of osteoarthritis management. The load on the joints and the degree of joint mobilization are essential to preservation of articular cartilage integrity. Other things that are helpful are acupuncture, yoga, massage, guided imagery, therapeutic touch, nutritional supplements like glucosamine or chondroitin sulfate. Based on the severity of patient symptoms, mild to moderate joint pain, patient could receive acetaminophen 1,000 milligrams every 6 hours. A topical agent like capsaicin cream, a topical salicylate like asparcream, or hyaluronic acid. For moderate to severe joint pain, the nonsteroidal inflammatory drugs or antibiotics. Home and work environments should be modified to maximize safety. Remove the scatter rugs. Provide railings at stairs and bathtub. Use night lights. Wear well-fitting supported shoes and assistive devices as needed, like canes, walkers, elevated toilet seats, and grab bar. The primary concerns are chronic pain and loss of function of the affected joints. Home management goals must be individualized to meet patient needs, and family members or significant others should goal setting and teaching. The expected outcome is to experience adequate amounts of rest and activity, achieve satisfactory pain management, maintain joint flexibility and muscle strength through joint protection and therapeutic exercise, and verbalize acceptance as osteoarthritis as a chronic disease, collaborating with healthcare providers in disease management.